It does not necessarily represent the views of WCIV ABC News 4.
Hi there, everybody. Fight Fraud First is a collaborative effort on behalf of seniors, persons with disabilities, military veterans, and family members. It's all to advocate for the elimination of waste, fraud, and abuse in Medicare and Medicaid. Joining me now with more information on this topic is former Democrat Senator John Breaux and former Republican Congressman Billy Tauzin. Hi there, gentlemen. How are you?
Good morning, Eric.
Hi, Eric.
Good morning to you. Now, if you can, tell us a little bit more about Fight Fraud First. What is this campaign all about?
Well, Fight Fraud First is a simple concept. It's saying that if Congress, through the super committee, of which Congressman Jim Clyburn is one of the important members on that committee, is charged with reducing federal spending, that we recommend that instead of taxing seniors or cutting their benefits, that there's an incredible amount of fraud, about $70 billion last year, which is about 38% of all Medicare spending, was attributable to waste or fraud or abuse of the program. So our organization is simply saying, before you cut the benefits to seniors, let's cut out the people who are participating in fraud and waste and abusing the program.
Is there a way to do that? Obviously, this can happen so much, and it's so important to keep an eye on it. How can it be done?
Well, you know, Eric, if you'd asked me that 5-10 years ago, I would have told you that the only thing you can do is fight to recover the money after it's gone. That's what the government is currently trying to do. There's a different approach today, and we're bringing that approach to Jim Clyburn and the others on the committee. Today, with dense data systems that combined with analytical systems, you can actually authenticate whether it's a real doctor, whether it's a real patient. You can identify whether or not it's a real medical treatment covered by Medicare or a fraudulent claim. And you can stop the payment before the money leaves the door. So what John and I are saying to the super committee is, look, if you can save a healthy part of that $70 billion from ever leaving the door, then you don't have to tax seniors with copays. You don't have to cut their access to vital healthcare services. You can save the money you need to save by stopping the dollars from flowing to the fraudulent crooks out there who are taking advantage of 38% of Medicare spending illegally. And you can do it today because of new technologies.
And you mentioned $70 billion. That's an enormous number. This is a lot of money we're talking about, isn't it?
Well, multiply, John.
Well, it's 38% of the total amount of money that was paid out of the Medicare program just last year. That goes to waste and fraud and abuse. And it's a much easier target and a much more appropriate target to go after than to go after the seniors who are innocent victims in this case. And the committee that Jim Clyburn is on has a very difficult task, but our organization has submitted to them in writing specific proposals that they could utilize and implement to attack the waste and the fraud that's in the program, rather than going after innocent seniors who are the victims in this case. And the end result is going to be a much better run program, and also saving the government a substantial amount of money.
Eric, we have a website. It's called AmericansAgainstFraud.org, and you can visit it and actually see the concepts we brought to the Congress.
Very good. And if Congress does not heed these warnings, are we walking on treacherous ground here?
Well, yes. I mean, imagine, if you will, that we're talking about the sickest, the poorest, the most vulnerable American citizens. The seniors, the veterans who served our country, the moms and dads who paid our college tuition and got us educated and built this country. We're talking about the people with the highest chronic disease rates in the country. We're talking about sending them into nursing homes and hospitals because we're not taking care of their health care needs at home, that sort of thing. That's horrible. Or else taxing them with copays and co-insurance to cover the debt that we've accumulated over the years. That's not the right approach. And we could seriously harm their access to health care if we don't do what John and I are suggesting in this coalition. Get the dollars that's going to the wrong places instead of cutting the dollars that are going to the right places in Medicare.
Eric, no federal program that wastes 38% of the total amount of tax dollars being spent on the program can ever survive. And I think the whole program's in real danger unless we correct what I think, and Billy and I think, is one of the biggest areas that need to be corrected, and that is the waste and fraud in the program before you try to go after seniors who are innocent victims.
And gentlemen, that website again, just in case folks didn't get it the first time.
is AmericansAgainstFraud.org. And by the way, we just did a survey, Eric, and 83% of Americans agree with us. And so we're trying to get that message to Jim and to the other members of the committee. Americans are with us on this. Democrats, Republicans, liberal, conservatives, they all agree. Let's cut the fraud out first before you cut seniors' access to health care.
We thank you so much for your time.
Thank you, guys.
Eric.
Thank you. And we have more Low Country Live on the way next. Stay with us.